20, Alex Wall is a veteran of the New South Wales mental health system. She's been in and out of care since she was 14.
I've always been very perfectionistic, and that pressure that I put on myself throughout school just kept growing and growing and growing. And I was falling and couldn't get up again.
A high achiever at school, sports and music, Alex has had 13 hospital visits due to ongoing psychiatric issues, the longest for 10 months.
We would go into ED and she'd be waiting hours, you know, in a distressed state. And when someone's in a distressed state, they need help straight away.
When Alex was admitted, she felt she didn't ever receive the care she needed.
There's not enough resources for people to be treated as an individual, taking in their circumstances and the reasons why they've been either brought in or they're presented to hospital. They are sending people out into the community who aren't fixed.
Alex's family say it was often left to them to pick up her care.
You can't even put words to it, actually. You know, this whole time has just been awful.
Public psychiatrists in New South Wales are no longer prepared to be in charge of care they can't provide.
You're in crisis all the time. You are managing crisis. You are not contributing to therapy. You're not contributing to meaningful care.
Tomorrow, the resignations of 200 publicly employed psychiatrists are due to take effect, unless the state government agrees to a 25% pay rise.
When you're so short-staffed, all you can do is, you know, you're putting out crisis after crisis.
Dr Pramudi Gunaratne is the chair of the Royal Australian and New Zealand College of Psychiatrists. She says at the heart of the crisis is a critical workforce shortage. A third of the state's specialist psychiatry positions are currently vacant, leaving doctors to make awful decisions.
Do we admit the patient to one of our mental health wards with the knowledge that as soon as someone with more, higher needs comes, that this person is going to be discharged with very little follow-up? Or do we provide them with a card that's got a phone number on it to have someone on the other side, at best, put them on a wait list that will last maybe, 6 months or a year?
Staff shortages are a problem nationwide, but according to the Doctors' Union, the situation is worst in New South Wales because the state offers its medical specialists lower salaries. Union data shows first-year consultants can earn about 50% more in Western Australia or around 30% more in Victoria or Queensland.
So if you're thinking about a 30% pay gap, that means for about 4 months of the year in New South Wales, psychiatrists are working for free compared to their interstate colleagues.
For psychiatrists, it's been a 15-month battle with the New South Wales government. In late 2023, they say they asked for a 25% pay increase to make New South Wales a more attractive place to work. In May 2024, the government offered all publicly employed specialist doctors a 10.5% pay rise over 3 years, a deal which was overwhelmingly rejected. Late last year, a 10% onerous duty allowance was offered. Then in December, psychiatrists were told their pay demands would only be considered if they could find savings through productivity and efficiency measures. Finding cuts in a system already stretched to breaking, doctors say, was too dangerous to consider.
It's really a very challenging suggestion because would you close a cancer ward? Would they close an orthopaedic ward? And when we talk about efficiencies, as well, the argument as well is that, would they ask neurosurgeons, for example, like people operating to cut the time of their surgeries?
The government says an immediate 25% pay rise would spark similar requests from the other 4,000 specialist doctors across the state.
We can't be in a situation where every 12 months we've got some kind of specialist that decides to resign. In the end, you can see where this ends up. The state goes broke.
So over 10 years ago, the emergency physicians in New South Wales were under a similar workforce crisis, and the solution for that was that they were given a 25% allowance on top of their existing wage, which has solved that problem.
This morning, the Mental Health Minister met with psychiatrists, but no resolution could be reached.
All right. Thanks everyone for coming along.
The wage case is expected to go before the Industrial Relations Commission tomorrow.
We're asking psychiatrists not to resign and putting forward what we think is a reasonable offer and accepting that it hasn't been agreed to by them and saying we want that question urgently answered by the Industrial Relations Commission and giving a commitment that the finding of that independent umpire the government will accept. That, I think, is a very reasonable path forward.
The government says it has sweeping contingencies in place, including a pandemic-style emergency centre and expanded telehealth services.
Contingency planning from New South Wales Health is well underway. I do have confidence that although it will be really challenging to have psychiatrists leave, and we don't want them to leave, we are leaving no stone unturned in making sure that quality mental health services continue to remain available.
Arrangements are being made with locums, some from overseas.
You can't run a service with locums. One, it's expensive. Locums are paid 2 to 3 times that of a permanent psychiatrist. But when it comes to patient care, these are people with complex, severe mental illness.
Premier, you have ignored us and the plight...
Today, psychiatrists who are not resigning have expressed support for their colleagues and concern for the system left behind. If there is no resolution, what do you imagine the public hospital system, particularly the emergency departments, will look like tomorrow?
As time goes on, it's very hard for me to see how in the hospitals that are worst affected, the emergency departments will still be functioning in a month. That's, I think, what we're talking about.
What does that mean exactly?
It's now a psychiatry ward, and there are no beds for people with medical problems. Ambulance will start ramping, trying to get into the emergency department, even more than they do now. So people will wait in ambulances with heart attacks, trying to get service. It's unthinkable what's going to happen.